Welcome, everyone. My name is Zach Miller with Landmark Ventures, host of the Social Innovation Summit. The Social Innovation Summit is a platform designed to elevate groundbreaking ideas and innovative leaders who are changing the world for the better. Throughout the year, we're honored to partner with great organizations to amplify conversations and explore solutions to the biggest issues of the day. That's why we've teamed up with AARP on a digital event series to elevate the national dialogue around issues that impact longer and healthier lives for all communities. Today, we're excited to continue that conversation and host a solutions-focused dialogue around the cost of inequity, closing the health and wealth gap, and approaches for driving equitable longevity outcomes for vulnerable populations. We've sent all attendees a digital brochure with the agenda for today and are taking questions from the audience that our speakers will answer towards the end of the discussion. So please submit your questions for our speakers to the Zoom Q&A function throughout the event. And now, without further ado, I'm pleased to welcome our moderator for today's discussion, the president of the AARP Foundation, Lisa Marsh Ryerson.
Zach, thank you for that warm welcome. Good afternoon, everyone. I'm just so delighted to be back with you and to be here as we launch the 2021 edition of AARP's Build Equity series. On behalf of the entire AARP team, I'd like to welcome you to what I know will be an insightful and fascinating conversation and a real treat, because today I'm joined by some of the nation's top thought leaders in the spaces of health and of wealth. We're very excited to launch with our partner, Social Innovation Summit, what will be a series of 4 solutions-based discussions on the actions and strategies that leaders can and must take as we think about, across all sectors, how we ensure the right to live longer, healthier lives. How do we ensure that that right is a centerpiece in our collective fight to address systemic barriers and close the growing opportunity gaps? Last year, as we all struggled with the COVID-19 pandemic and wrestled with a national conversation on racial equity, we connected with top thinkers to understand the sources of inequities in longevity and wealth. And now we transition to the tools we can bring to bear on these challenges. And we can continue the vital work of evolving our national conversations. And I would suggest we need to evolve them from a deficit-minded approach where we talk about what's missing to one which is focused on how we can build upon the assets that do exist within our communities. We'll start this series examining a fundamental question. How can we ensure that all people have the ability to live longer, healthier, more financially secure lives? And we know that we cannot address the goals of longevity without addressing the inequity and systemic discrimination that causes financial and health disparities. At the foundation, for example, we're working to end senior poverty by helping vulnerable people over 50 build economic opportunity. And in everything that we do, we prioritize strategies that increase both equitable access and also increase equitable outcomes in our programs and our services. All of the panelists who are joining us today are experts, not only in their respective fields, but also in the importance of collaboration across all sectors. We've had so much loss collectively over this past year, and the challenges ahead of us are daunting and complex. But I'm reminded of a message from one of my favorite artists, Joan Baez, who once said, "Action is the antidote to despair." So it is in this spirit that I'm thrilled to have a conversation with 3 distinguished leaders who will help us think about what we can do in this moment to bring about justice, to bring about positive change as we work to ensure that all people have the ability to live longer and healthier lives. We look forward to this engaging conversation today and to connecting with you across 2021 as we build solutions together. So now let's get started. I'm delighted to welcome our thought leaders to join me on the stage. A warm welcome to Ray Boshara, who is the Senior Advisor for the Institute for Economic Equity at the Federal Reserve Bank in St. Louis. And Cara James, Dr. Cara James, who is President and CEO of Grantmakers in Health. And a warm welcome to our colleague Haim Israel, who is global strategist and managing director of research and head of the global Thematic research team at Bank of America, Merrill Lynch. Ray and Haim and Cara, what a delight it is to be with you today. I want to jump right in to our important conversation and really start with an opportunity for you to talk about the following question in light of the work that you're leading. We remain in the midst of a pandemic, really of the convergence of three pandemics. So what have you learned or seen this past year is part one of the question. And the second is, what gives you hope, or what is positive action that we can take going forward? Cara, let me start with you.
So thank you so much, Lisa. I'm really excited to be here today to talk about this important topic. And I thank you and AARP, excuse me, and the Social Innovation Summit for inviting us. And I think, there've been a lot of lessons that we have learned from last year. And I'm just going to kind of highlight a couple that I wrote about just last month and sort of my reflections of 1 year. And the first one, when we think about this equity conversation, is that we have seen that disparities persist in every facet of our society, from health, education, employment, housing, job, everything as we think about it. And to address these issues are going to require significant and sustained effort. The second thing that we have seen is that our patchwork health system fosters some of the disparities that we see and has led to partial solutions for some of the challenges that we have. And we really need to think about that. We've also seen the critically importance of leadership at every level of our society, from federal, state, local, nonprofit organizations, corporate, everyone. Leadership has been critical to this year of people being able to adjust and move forward and survive. And state and local governments are critical in addressing the problems, and they often are lacking some of the resources. But one of the things that gives me hope is one of the final lessons I'll kind of lift up is that we have been and remain an extremely divided country at this point in time, but we can still come together to help each other out. And we've seen examples of that at every level, from community on up, people working together to provide needs for their neighbors, to help those in need to be able to move forward in this time. And the stories of that keep me hopeful that we will be able to come together to address these really challenging problems that we have.
Yeah, thank you, Cara. I think it's so important. You've helped us remember the power of focus. So we've learned a lot. We have seen disparities in a heightened form, but we've also come together in new ways. So it really is about that sustained effort. Ray, join the conversation.
Thank you, Lisa. Thank you to Social Innovation Summit. It's an honor to be here. I'm going to echo a lot of what Dr. James mentioned and just say that just remarkable how the pandemic not only exposed, but exacerbated the deep inequalities in health, wealth, and income, that we had been documenting at the St. Louis Fed. By 2019, just in the last 30 years, the bottom 50% of the population had seen their wealth go from 3% to 1%. Okay, we were already at the bottom half of the population having just 1% of the nation's wealth, and that was before the pandemic. So we are documenting the effects of the pandemic, and it looks like inequalities along racial, gender, generational, and educational lines are likely to get worse than they already were. What gives me hope is that I think this very exposure has brought about a historic opportunity to sort of remake the social contract, to reset and to do things differently. I happen to write a book on the progressive era in American history, and I'm seeing a very similar convergence of political, economic, technological, social forces, that make big change possible. So, it's a crisis, but crisis breeds opportunity, and I'm optimistic about the opportunities we have to do things better.
Yeah, thank you. Thank you so much, Ray. And you're right, it is a crisis. We're going to get back to those widening disparities soon. But again, like Cara, I appreciate that you're saying there is this moment that we've been sharing together. So now it's about collective will and focus to come together across sectors and make the change that we know has to occur systemically. Haim, we're so happy that you joined us across time zones. It's just a real treat to have you here. So please join the conversation.
Pleasure. Thank you so much, and pleasure to be here, Lisa. I'm filled with optimism. We've been through, I think, the worst crisis in history. Never, ever in the past, more than 90% of the world GDP was shut down. Never, ever. We lost many, many lives. It was a tragedy, such a tragedy that, everything that happened last year. I'm full with optimism because I think this is the point in time that governments, capital markets, people, organizations understood that things are about to change. There's an interest for things to change, as I will explain I'm sure we'll explain here in this conversation today. Technology have proved itself again and again as probably the bridge of between people, between nations, between different social classes, and so on, and will be brought forward. We need to understand one thing: pandemics are like rivers. When a river passes, it will never ever stay the same. What was very unique about the COVID crisis is that we actually did not really created new trends, new themes, new megatrends. It accelerated everything. And the thing that it did accelerate is technology. For the short term, we are seeing exactly as Ray said, as Cara said, we're seeing a reverse in a lot of the trends, which are very unfortunate. Inequality. We are seeing loss of jobs and massive economic impact, health impact, and inequality across the board. I think from that, we will see a convergence of interest between governments, people, generations, social stuff that will actually help us to emerge much better than that. All that in the aspect of technology, which has just boomed during the last year. It did what it did not do for the last 10 years.
Yeah, Haim, thank you. And now I have the image. I'm so glad that you reminded us of the river. So the river has some of its same fundamental aspects, right? Its systems, but it emerges as a new river. And of course, that's what we're going for here as well. So thank you. And I love that you're filled with optimism, even in the face of these disparities. I want to turn to another topic, and I'll start, Cara, with having you and Ray jump in, and then certainly Haim can add to it. As all three of you have talked about the disparities that have already existed in our society, going back to the river, thank goodness it's new, because for a vast majority of people, they don't want to go back to the way the river was before, because that river did not provide them with access to the opportunity of longevity and to the financial and health support that they needed for security. We also know that we had been collapsing the life expectancy gaps, but now again, it's increasing when you think about, especially across lines of race. And in fact, between Black and white Americans, it really had decreased. And now we have the widest gap since 1998. So Cara, I want to start with you. What are some immediate steps we can be taking to address this disparity, because it's squarely rooted in negative health outcomes?
Right, it is, and it's it's interesting because unfortunately part of that closure was also attributed to the loss of life associated with the opioid epidemic. And so we did see a decline for the first time related to that as well. So that's not how we want to close the gap in terms of having that. We are seeing, this change that you mentioned, and I think we're beginning to see some of the supports coming out. So when we think about what are those immediate things that people need, it is, the necessities, being able to have food, access to healthy foods and stable housing, and as well as getting back to employment. And we're seeing that the jobs numbers are returning, but again, we're still seeing a disparity there. And we know that the recovery is going to take time, and it's not going to be an equitable recovery because of all the other structural issues that are in place. So making sure that we continue to support these communities as they're coming out of the, as we're responding. And to also, I do want to just say we're very enthusiastic about the future, but it is worth reminding people we're still in a pandemic.
That's
There's
right.
so many people who are not vaccinated. We still need the basic precautions and protections, and especially because for Black and Latino communities, these are the people who are essential workers, still very vulnerable. Still, we're not seeing them get vaccinated at the rate. So we need to make sure we're making those protections and precautions available so that they can continue to weather this storm and do better, but also get them vaccinated so that they can recover healthy as well. But I think making sure we're putting in those basic protections to get people vaccinated, helping out with those communities, providing the supports that are needed for a long-term recovery, and understanding that even when we get national numbers, we still need to be looking in these communities to understand where those challenges are to support jobs, food, training, education, and get the kids back in school.
Yeah, Cara, as you're talking, and I'm curious about how Ray and Haim are hearing this as well, you're reminding us of the critical importance of social determinants of health. So immediate steps need to be taken to realize that helping those who've been most left behind secure the essentials is in everyone's interest. It is about individuals and about communities and about national well-being, and more focus there is a step we need to take to address long-term disparities. So thank you, Cara. Ray, you want to add to this conversation?
Yeah, just a little bit. I mean, once again, I think everything Cara said is right on target. I mean, we can't do enough with, the CARES Act, the rescue plan, vaccines, getting schools open. Absolutely endorse every bit of that. I'd say three things if we want to take immediate action that need to be done. One is just to continue to build up the emergency savings, the savings buffers that families have. There's a remarkable amount of research showing that no one intervention does more to stabilize families than having access to emergency savings. By having those funds, you prevent a further downward spiral, but you also have a little springboard to opportunity, starting a small business, pursuing an education or some skill. So I think that's really critical. There's a lot of great research saying that's the most important thing we can do. Secondly, would be debt relief. It's a very easy thing to do from a sort of a government policy perspective, but my goodness, forbearance on mortgages and immediate relief on student loans, credit cards, and auto loans in particular. And then finally, I'd say, as I mentioned, we're in what I think is another progressive era. And when policymakers want to do big things, whether it was FDR or Wilson, they looked around for the state and local innovators. And so those need to be highlighted. And we need to bring those up to the fore so that policymakers have a template about what works. And so this is the time to talk about our innovations and to highlight those, because we need to know what works.
Yeah, I think that, it's so important, Ray, and you're going back to research that you've been engaged in over time. But time and time again, we know the evidence says, as you highlight, the small buffers of emergency savings that are there for someone to tap into and then begin to build again. I also love what you're saying about innovation. And I think it's about creating solutions with the people who need us most. So it isn't, solutions that come down upon people, but how do we co-create with vulnerable people and populations? Haim, I want you to jump in and talk about your work and research and thinking in the critical connection between wealth and health. Sure. And what are some solutions in that space that are supporting your galloping optimism?
So I do believe that this connection between health and wealth is happening right now. And again, the bridge is technology. Because what happened during this pandemic, as we had the mirror in front of our face, understanding that the healthcare system worldwide is completely broken down. And let me give you a couple of examples, what's going on and how that's going to be fixed and helping all of us. Today, globally, we spend 10% of global GDP, 10%, that's $8 trillion worldwide on healthcare services. That's a big number, and it's okay, but the problem is that today, by definition, 40%, $3.5 trillion is going down the drain every year by definition, because, let me surprise you, the healthcare industry worldwide is using very old, backward technology. It's actually using 2 or 3 decades away technology. It's not using big data, AI, all the stuff that is being used today. And that is the moment of definition, I think, for the global healthcare market. We can start using new tools, but dramatically decrease the cost. Let's one example. How do you develop a drug? How do you develop a vaccine? Trial and error. That's how it goes. You're taking a molecule, test it, works, great. Not working, let's move to the next one up until something catches. 1 out of 15,000 molecules is becoming a drug, an average 10 to 12 years. Now, what happened recently? We didn't use those same methods to develop vaccines for the COVID crisis. It was all based about data. All the data is there. We can dramatically decrease the cost, increase efficiency. Another example, DNA. To sequence your DNA today costs you $100, and you'll know everything about yourself for $100. In 2003, it was $2.7 billion to sequence your DNA. I did it for $100. I know everything about myself. I can start preparing, predicting, personalize my treatment and my drugs, and dramatically decrease my healthcare expenditures by more than 80%. And this is what governments are going to chase from here onward. This is why I'm so optimistic going forward, because it's a national interest for government to get a much better healthcare services.
Right.
80% decline in prices, and that's what's going to happen in the future. It's already happening because government said one thing: health is the new wealth.
Yeah, it's so interesting. I mean, you're really echoing the comments from Cara and especially from Ray just a moment ago about the importance of that, an entrepreneurial mindset, really thinking about how innovation can drive the changes that we need as we develop systems and those connections between health and wealth. Cara, I want to turn to you because you are an expert in health, and on my mind has been, and I know on yours as well, that whether it's what we've seen in the past year about long-term services and supports, about nursing homes and community hospitals and healthcare systems of all sizes have really been at the center during this pandemic. So are you seeing, or could you guide us toward cross-sector collaborations that are emerging, or we need to lift up more as we address the issue of disparities? Because it will take all sectors pulling in the same direction.
Absolutely. These are not problems that one sector can solve alone. And, right. The pandemic has provided examples of many different sectors coming together to lift up problems and to address them. So we saw philanthropy working with CDFIs and other community groups to address needs related to transportation, to PPE and other things to get those immediate needs. We're seeing a lot more people who are lifting up a focus on health equity, and I think that provides a lot more opportunity for partnership and collaboration. I think in the corporate world is one that really has taken a stand on health equity, which is great, and we're seeing resources flowing into communities as people are thinking about how to build wealth, how to empower communities and put those social supports in there. And that's really important. And I think what we, sort of ideally need is a little bit of a directory of who's doing what, so that there is a lot of activity. There's not necessarily a clear roadmap on what to do.
Right.
And I think that's one where some of us are thinking about, what are the things that we all could work towards. We're seeing collaborations and partnerships even now around the vaccine, because as you know, we've been fighting multiple pandemics, not just one with regards to the virus, but also one with regards to misinformation. And so making sure that we're getting that information that's accurate, clear, concise in the language of preference for individuals from the trusted resources that they use is really important. And those collaborations are also happening. So we continue and hope that, as we move forward, we build on those. I think we're also seeing in terms of partnerships, from things that have already been in place with regards to, for example, the census last year and getting people out in civic engagement and voting, how they are pivoting to think about how they can support the vaccine. So I think there's the pandemic has bred a lot of collaborations, strengthened ones that were already in place, and we just need to continue building on those and bring in more people to those collaborations so that we can expand the impact and maximize that work that we're trying to do.
Yeah, I think you raise a challenge for us, and I want Ray and Haim to jump in, which is that we have to also sort of think beyond the usual partners. So the best of collaboration is thinking very broadly about strategic partnerships. And then you're emphasizing for us, Cara, it takes a lot of willpower and perseverance to work in a collective impact environment. And there isn't any one solution that will work necessarily for every population or community. So we have to be also willing to pivot and to include the communities we're serving and working with, or our patients in healthcare, and helping us develop those solutions. Ray and Haim, can you add to this dialogue about motivations to continue this cross-sector collective impact to address health equity and wealth disparities as well?
Yeah, I don't have a lot to say about partnerships per se, but I will say that we wouldn't have health and we wouldn't have wealth and income inequities without public policy without government having
That's
played
right.
an active role in sort of figuring out who gets access and who doesn't, who gets support and who doesn't. And so just, we studied the racial wealth gap, and you can't understand that without understanding the history of who gets to build wealth and who doesn't get to build
That's
wealth in
right.
this country. So while behavioral interventions are really important, the structural, institutional policy framework is probably the most important. People behave, but so do institutions. We need to
That's
get
right.
institutions to behave in ways that make it easier for people to get the health and wealth and income outcomes that they seek.
Yeah, I think that, again, you all, as I said in my opening, what a treat to be with the three of you as such expert and really actively engaged thought leaders. But Ray calls out for us what we've been talking about, which is just as we're talking about the best principles of cross-sector design, we best remember that we are where we are because of design as well. So the outcome we're facing, the disparities, were by design as well. We have to be really focused on root causality as something else that I hear as a thread in all of your comments. We can't fall in love with a solution and in search of a problem to solve. We have to keep calling out what the root problem is and being sure that we're continuing to solve it. Haim, you started in your opening comments to talk about strategic partnerships across sectors. Would you like to add to the dialogue?
Yes, so I'm going to surprise you a little bit. First of all, I have to echo what Ray and Cara said about eventually you need the policy, you need governments, but this is where I'm going to surprise you. It's going to be led by governments, and it's going to be led by government. That's going to be the key strategic partner, because government understood that, as I said, health is the new wealth. And I'm being maybe a little bit sarcastic here, but look at countries that managed to contain the pandemic and get out of this situation faster, open the economy faster, and actually helping the population communities. Of course, China is the best example, Israel, other countries. So countries understand there is a geopolitical power when you do that. So you will see more and more government intervention on that aspect. And here's where I'm going to really surprise you. And usually when I say that, a lot of people first laugh or raise their eyebrows, but the entity or that will help to solve the problem and your best partner is the capital market. Capital market will solve the problem and will be the major, I think, the number one partner here. Let me give you the example of what I mean by climate change. We know about climate change since the 70s. For the last 50 years, all we're talking about climate change and climate issues and problems. What we achieved in last 12 months was 2 times more than what we achieved in 50 years. And why is that? Because the capital market got involved through ESG funds, through money that is allocated specifically on environmental, social, and governance allocation. $82 trillion worth of assets which are committed to those kind of things. And this number is going, by the way, $82 trillion, 3 times the size of the S&P 500. That number is going up by the day. And when you see the money that is flowing and is very directed about social things, inequality, gender equality, racial equality, of course, climate change issues, you have no choice. And that's why I think that what we saw in the last 12 months from climate change, and take the consideration of what COVID have made to our societies and communities, all the damage, and now the capital market understood there are yields, there are returns, there's thing to be done over here. I'm very, very optimistic, and this is going to be your number one partner.
Well, it's interesting, Haim, and I really want Ray and Cara to jump in here. I didn't raise my eyebrows, and maybe I'm raising them now. This is your work to know this space and research it. But I would be remiss if I didn't say, what's different now in the capital markets that have been a force across all time, and yet we haven't addressed these fundamental issues of equity. So, Cara and Ray, if you jump in, and it's the combination of capital markets behaving organizationally, as you, Haim, and Ray are saying, to get the right work done. Maybe they're more compelled to do that now. But Cara and Ray, jump in.
Yeah, it's interesting because I will leave the capital markets conversation to Ray, but I was struck by Haim's optimism about government, and I think that government, yes, has an important role to play, and we're seeing with the American Rescue Plan Act that a lot of money is flowing from the government into communities. But I think, as both Ray and Haim have said, we actually have to get down to the root causes and change those policies. And that's a lot harder for us to do in a country as ours and a divided government. And when you look at other countries and how they spend money on health, they spend a lot more of their money. First of all, we spend more money than everybody else. We all know that.
That's
but
right.
It's also the percentage of our money is less of it goes to prevention and social services compared to other countries. So there's a real skewing of how we spend our money. And then that again goes to the policies that we have in place. And every system is designed to do exactly what it does.
That's right.
So that's what we're seeing. And so we really have hard work to do to really undo those systems. And I'm not quite as optimistic that our government will get there. But I think that the conversations that are happening now, exactly as you started off with us, to rethink about the social contract that we have, because this has exposed a lot of the flaws with the way that we have set our system up.
Yes.
When you think about health, wealth, all of those pieces, for health, the basic thing of health coverage is tied to your employment. And if you lose your job, you lose your health insurance in many cases. And the ironic thing is that the system that we have set up to take care of low-income individuals in Medicaid is predicated on state tax dollars, and at a time when it's most needed is also most strained. And so we see that is a challenge going forward.
I mean, Cara, again, all of you, many, many examples of, we get the result that we're set up to get, as we're saying, and we really do need to shift it. I don't know, Ray, if you want to, and I want to talk in a minute about how we can shift towards thinking about the assets that we're losing in terms of people and communities. But Ray, do you have anything to add on this conversation about the capital markets?
Well, just briefly, thank you, Haim. I think it's a fascinating comment. I agree that financial capital is increasingly necessary to realize the other kinds of capital we need for the good life. So if you want human capital or education or social capital, environmental capital, real capital, increasingly because of the financialization of the world, financial capital is necessary to realize all those things.
Right.
So I think it's a welcome sign that you're discussing. I worry, as does I think Lisa, that are the incentives aligned enough to solve some of the big issues that capital markets, without a strong role for government as well, can really tackle enormous disparities in health, wealth, and education and income.
May I just
absolutely.
I completely agree. It all comes down to an incentive, and the incentive is there. And you asked before that, what's going to be different this time around? When you look at, without going into the aspect of ESG assets, when you look at companies, investing in companies which are doing good, you also do good for yourself. The returns are better, the multiples are better, the volatility is lower, and that's the essence of ESG. So it's actually, do good and do well. That is what changes. And when it comes to governments, the incentive is very, very clear. It's all a geopolitical game. That's how I believe it. When China managed to contain the virus very fast, you cannot have the US behind. When other countries are starting to already completely change their health system because they understand the capital which is involved in that and the wealth which is going to come with that, you are not going to be left behind. That's the situation as I see it over here.
It is. I think we're all kind of coming together, as I'm hearing it in our conversation, that this is this moment in time where, as Cara said, the roadmap's not totally built yet, but we better start building it. And we have to do that very much in a multi and cross-sectorial way, because you have to have all of us moving across sectors in the same direction toward the same goal of rebuilding the social contract. I want to move a bit and continue our conversation about why the topic of longevity really is an equity issue. And I'd like each of you to talk about that. And as you speak about it, what about the lost potential? If we don't see longevity as an equity issue, what are we losing collectively in this nation? Ray, you want to start?
I just want to make one brief observation. Most of my work is focused on the economics, the racial wealth gap. And many of you might have noted that President Raphael Bostic of the Atlanta Fed, as well as Sandy Darity at Duke, who wrote an important book about reparations, along with a reporter at the New York Times, Nicole Hannah-Jones, have all come to the same conclusion, that the best barometer of racial progress overall is the racial wealth gap. Okay, not the income gap, not the education gap, but the wealth gap, because
Right.
it's the best, it captures previous sins, but it also embodies future hope. So if we, and we've had remarkable progress over 30 years on voting rights, political representation, education, but it's not translating into more wealth. So
Right.
if you don't solve the racial wealth gap problem, you still have a fundamental racial inequity that's persisting. My only point here is that I think longevity is another one of those key barometers of how we're doing. If we extend lifespan, and longevity, it's a real marker that we're doing a lot of other things right. Many of you know that when Raj Chetty put out his research on the kind of the geography of longevity and on lifespan, he documented at least a 3-year difference between otherwise situated Blacks and whites. Now, 3 years may not seem like a lot, but if we were to eliminate all cancers, we would add 5 years to people's lives. So I think, to me, longevity is like wealth. It's one of the best overall barometers of all the things that we care about.
Yeah, thank you. Thank you, Ray. It gets to another question I'll have, but Cara, I do want you to jump in on this.
Yeah, no, I think that, we really need to think about equity in everything, equity in all policies, equity in all outcomes. And longevity is one of those. And I agree with Ray that it is exactly, sort of a marker. And unfortunately for us, disparities start at conception, where we see higher rates of infant mortality for Black and American Indian women. And, that continues with 1 in 5 children living in poverty who are Black and, growing forward. And so we see that, so that when you get to old age, as Ray was just talking about, it's not surprising that we have, non-Hispanic white adults who are in Medicare with a savings on average, a median savings of $118,000 compared to only $15,000 for those who are Black and $10,000 for those who are Latino. So we also want that longevity, but we want good quality of life. And when you think about what wealth provides you and those savings, it allows you that ability to age as you would like with the choices that you want to make. So if you have, $15,000, we've all spent a year at home and we've all looked around our homes, looking at things that need to be improved. And some of us have been in a place to make those improvements. But if you are an older adult who's living with a savings of $10,000 or $15,000, your ability to add grab bars, provide ramps, or other things that can give you,
or even basic maintenance.
Basic maintenance, exactly. That independence at home is not necessarily a choice that you have. So I think, longevity is a great marker, but we also want a high quality lifespan as well. So
yes,
very much equity issues and things that do take time for us to address. So.
Well, all 3 of you have really talked about this as cumulative over time. So I think, Cara, an important reminder for us, it's equity in everything. And we have to start thinking more holistically about the solutions, which we're going to go to the audience really quickly here, but leads me to maybe one final question for all of you, which is about intergenerational impact. And so when we think about health equity and wealth equity, when we think about multi-generational families living together, that provides a different lens for us to think forward for solutions. So Haim, maybe I'll start with you, speaking about intergenerational connections and their importance.
This is so important, and I'm so happy you raised it, Lisa, because we are in the middle of a revolution right now. We talk about intergeneration situation right now, and I'm talking about the younger generation, Gen Z. And everything we spoke about right now, of course, we are focusing about the baby boomers and we are focusing about the elderly population, but everything that we raised today has been multiplied in terms of importance to the younger generation, Gen Z. People that were born between 1996 2016, now starting to get to the age of 20, 20s, early 20s. They're going to be so important going forward. Why? First of all, because life expectancy is increasing by definition. Yes, Ray is completely right. Between different groups and ethnic groups and gender and whatever, it is changing. But overall speaking, every 5 years that you live, add 1 year to your life. Meaning, if our audience will survive 1 hour, we just added 12 minutes to his lifespan. And what's going to happen eventually? And that's the problem with Gen Z, because think that Gen Z is going to live to their 100 years old, and this is where we're heading, 100 years old, meaning they're going to work from their 20s up until their 70s. 30 years of their life, they're probably going to be in pension. Who's going to finance that? Already today, the pension deficit today is $24 trillion worldwide. Now we're talking about new generations that is probably going to be very different. So that is a critical question going forward. And Gen Z thinks very, very differently. Will work in very different work, will not use financial services as we do. Actually, will not take loans, which is very important. So this is, I think, is critical going forward.
Yeah, and it is. And Ray and Cara can jump in again. Haim, thank you for that. It really is putting a finer point on a layer of disruption, which is so significant going forward. But it does return to the point that the three of you keep making, which is that equity has to be built into everything. And if we want a more just and equitable society, we have to understand fundamentally who has been locked out of opportunity and how do we prevent it from happening. As you said, Cara, these are cradle to grave issues, and the solutions need to be as well. So if it's all right, Ray and Cara, do you want to jump in? I think that Haim really raised this important conversation about what's happening across and between generations. And then I'm going to move to a very interesting question that's in the chat. Ray or Cara?
Cara, do you want to start?
I'll just do a quick 30-second. I think one of the things when you look at the multi-generational impact, it's not just from the financial standpoint of what that brings, but also the social support and sustainment for these generations. And so as we go forward and think about this, again, thinking about who's been most impacted by the 500,000 deaths that we've had as a result of COVID and what that loss means to those communities, those families, those individuals. So how do we create those support networks to help boost them to continue that, because they will have, they'll be further behind having lost that support network.
Yeah, I think, Cara, that's important, because what you're saying is we can and should move boldly ahead to new solutions that build equity, but we can't do so unless we really understand what's occurred, the lived experience right now and the impact of that. Ray?
Yeah, I agree with that. And I just wanted to add a little bit of nuance about generations. We've studied generations and how they're comparing to previous generations. And we found, unfortunately, one of our most disturbing findings is that younger generations are on track to have less wealth than their parents or grandparents at a similar age. Now, our data only allowed us really to go to millennials, but the data are really quite remarkable that, some millennials are on track to have 36% less wealth than their parents did at the same age. And it's declining across generations. And, and I think that poses profound questions about the stability of the social contract, which is where younger generations support older generations. And our data show that older generations, while there's a lot of poverty and insecurity, is historically at least one of the wealthiest in US history. And I think we need to rethink the social contract. Could we reverse it a little bit so that there's more support going to younger generations? I wish we had data on Gen Z. We don't. I'd like to believe that there is a lot of reason to be hopeful and optimistic. I wish we had data. Certainly we hope that they do better than millennials have.
Yeah, it is, Ray. That's a whole nother webinar. And I would love to be invited back to be with all three of you. And of course, from my point of view, what we really need is for everyone at all ages. And in particular, with that crisp, clear focus on what we know are the issues of disparities and inequities. So people who've been left behind because of their race, their ethnicity, because of other discriminatory barriers, that's where we need to focus. And and have this promise, I believe, of longevity for more people. Very exciting conversation. But now, there have been great questions in the chat. So one that came up is a chicken or egg question. And the question I think is so good. Our colleague who raised it is asking you, is it safe to say that wealth comes first and that leads to health? Solving for wealth comes to health. On the other hand, if you don't have health, how can you remain employed and have wealth? So Cara, I'm going to turn to you first, and then Haim and Ray to address this question.
Yeah, it's a great question. I think that I'm going to go with you need the wealth to get the health. Because when we think about, wealth from the standpoint of mothers who are having babies and the likelihood of having food, access, better health, it leads to a healthier pregnancy, healthier birth outcomes, opportunities to engage in school, and also the resources and support to help those individuals grow into healthy adults, and then continue so that if they are ill or have an injury, there is that support to be able to sustain them better than if they do not have that income. Now, admittedly, if you don't have health, it is a lot harder, but if you don't have health, it's a lot harder if you're poor than if you have the resources and the supports to be able to deal with that, whatever the case may be, injury, illness, disability. So I'm going to argue that you kind of need the wealth on the front end, but it obviously helps to have health, and health is the greatest wealth.
Yeah, so I hear what you're saying. So we need resources, financial resources to keep this, to make this cycle more virtuous. Haim?
I agree with Cara. Yeah, it starts now with wealth, which leads to health. But I think this chicken and egg is about to reverse. I think that because of the intervention by governments going forward, and I know I'm a little bit sarcastic over here saying what are the real interests of governments, we will see the healthcare expenditures dropping dramatically in the coming 10 years because of the intervention technology, because of the infusion between what we call biology and technology, use of new tools, technological tools to develop drugs, treatment, spending way more on prevention than on treatment, using new tools which dramatically will decrease expenditures, and you already see the private market already all over it, which eventually will lead to health, which will create wealth. So I do believe, exactly like Cara, right now, wealth is creating health. It's going to reverse.
Right? Thanks, Haim.
Yeah, I think there's evidence that health predicts wealth and wealth predicts health, but I think the stronger relationship is that wealth predicts health. The dean of the Harvard School of Public Health said if you want to solve the racial health gap, you got to solve the racial wealth gap.
Right. And I asked all of you that, but I would weigh in and agree with all three of you that really increasing economic opportunity so that all individuals have the resources they need to secure the essentials in life and then to build their wealth and health simultaneous is really important. Another interesting question from our colleagues, which is that even as you anticipate emerging from the current COVID-19 pandemic, we're still in the midst of it, as Cara reminded us, another pandemic will come or some disaster will come. So what steps among the many that you shared today do you think we have to take immediately so that the disparities or inequity gap doesn't widen before the next pandemic? That's a big question. Ray, you want to jump in? Looked like you were pondering.
It's a great question. So I think the most important thing is risk pulling. I mean, the social contract is all about managing risks. And I think the risks that we insured for in the 20th century are different than the risks that we're going to insure for in the 21st. So now we have to think about pandemics. We have to think about climate change. There's a whole range of things for which we didn't insure properly for. So to me, as part of the next big package, coming out of Congress, I hope, includes, rethinking the kinds of risks that we think we have to better insure for so that we don't have to have multi-trillion-dollar rescue packages when a crisis emerges. We can better be prepared for those by better risk sharing going forward.
Got it. And we've had our eyes opened about what these longstanding risks are. Cara?
Yeah, I think I'm going to add two more things to that. I think we really do need to look at our systems so that, we have struggled to be able to respond systemically to what's happening. We've kind of done a little of this and a little of that. So how do we actually build cohesive systems that will allow us to quickly respond and have kind of an equitable response? The other thing I'm going to say, which we haven't necessarily talked about, is we need to build better data infrastructure and better data systems, because we don't actually have the ability to look at a lot of these issues at sort of a race ethnicity level. When we talk about longevity, the numbers and the life expectancy that come out are white, Black, and Hispanic. We don't have great numbers for American Indians, Alaska Natives. We don't have great numbers for Asians, Native Hawaiians, and other Pacific Islanders. So
Right.
thinking about our data, and with the pandemic, we still have a number of states who are reporting vaccination rates, and we don't know whether or not communities of color are getting those vaccines. So it's not as exciting as some of the other things that we need to do, but we actually do need to focus on our data infrastructure to make sure that we can report and track and monitor what's happening, because if you can't measure it, you can't monitor and know how you're doing on it.
Yeah, Cara, I actually think it's quite exciting. So I appreciate that you raised it, which is that prioritizing data, the data that we need, and building the body of evidence so that we are designing for a more equitable future is really key. Otherwise, we risk allowing organizations, individuals, and nations to not know the facts. So I think it's really, really
to use
important.
that as an excuse to not respond.
You've got it.
You don't know how much of a problem it is.
Right, or to keep embedding solutions with no evidence of success or change for them. So Haim, I want to turn to you with the wrap-up question, and then have Cara and Ray jump in that came from someone and hits on something that you were talking about earlier, which is, imagine the three of you that you are a policymaker. It could be at a local, a state, or a national level. What policy would have to be put forward, a priority policy to address the growing wealth gap?
So, wow, that's there's so many things you can do. First of all, what's
your top one?
My top one is education, education, and I think that's probably key. B is technology. The two things have been proven in the past. Faster internet, technological solutions, and education could decrease dramatically wealth gap, can increase GDPs, can increase wealth, all that. So I would go out in massive investments across the board when it comes to technology, infrastructure, and education. That's, I think, the number one things I would do. I would promote investments. I would promote, if it's the private market or the public market, investing in those three areas. I think that's the number one thing. After that, there's a series of things we can do and have to be done, because this is a big issue, an important issue. This is the top priority.
Great. Thank you. I see you nodding, Cara.
Yeah, I wholeheartedly agree on education. I think that is one of the biggest places where we have some huge disparities and lead to a lot of the gaps that we still have. Technology, also critically important. I mean, I saw, one of the questions related to telehealth and technology and access.
Yes.
It's not just a broadband issue. It is actually internet and the ability to utilize technology, especially given the fact that, as an example with the vaccine, we built a lot of the vaccine registries on technology. And if you were calling in or trying to do it another way, you weren't getting a vaccine. So I think that is technology is another thing. And then the other thing I would say is to go back to something that Ray had mentioned in some of the debt forgiveness, so that we stop nickel and diming people when we think about, late payments or things like that are costing people significant amount of money for that, because they don't have the cash for that. And then the last thing I will just say, because of the health perspective, is to talk about our health system and how we are addressing that to make sure there is equitable access so that people can build the health that goes along with the wealth, and to restructure that in a way that focuses more on the prevention and keeping people healthy rather than waiting until they're sick and treating them.
Excellent. Thanks, Cara. Ray.
Yeah, I'm all in favor of education, but I would note that education is actually making the racial wealth gap worse, not better. the wealth gap gets worse as education rises. So we have to do something about the quality of education and the financing in particular. Student loans are one of the reasons the gap is worse with education. My favorite idea, one I've worked on for 20 years now, is the baby bonds idea, baby trusts idea. 7 states now set up a 529 college savings account at birth for every kid automatically to be used for education later in life. I worked on some bipartisan bills in Congress that did that. Israel, as Haim knows, is actually doing this. They connected their savings accounts to the child allowance. And I think if you don't renew opportunity afresh with each generation, it's really hard to expand opportunity and to build wealth. Inequality of outcomes in one generation becomes inequality of opportunity in the next. You have to have something to break that cycle. So a fresh endowment of assets at birth renews the promise of wealth and opportunity for each generation.
Yeah, well said, all three of you. It is in your response, very, very thoughtful responses and expert advice across all of the questions, but in particularly in this wrap-up round, you have reinforced for me, and I think the entire audience, that you have to have holistic solutions, looking at the layering of all of the sectors coming together and embedding equity as the outcome in any solution that is devised. We cannot just invest in education, invest in healthcare, and hope that equity follows, is what the three of you have shared today, and that is so important. So I have to say that I'm really sorry that we have to wrap up. I want you, Cara and Haim and Ray, to know what a real privilege it has been for me today to be able to sit with you and to learn from you, and what a superb kickoff for the 2021 Build Equity series with AARP and Social Innovation Summit. You've really focused my thinking and our collective thinking on learning from what has occurred on these converging pandemics of ongoing systemic racism and discrimination, of COVID-19, and of economic challenge and downturn, but also of the optimism. There are organizations, individuals, public, private, nonprofit sector. We can come together and we can rebuild a social contract, increasing opportunity at birth and across the lifespan, so that older adults have the opportunity to choose how they live as they age. So thank you for all that you're doing. What a gift it is to have your leadership. And thank you to all for joining in today. It's been a treat to be with everyone today. Thank you. Join me in thanking Cara and Haim and Ray.